Hello and welcome for another update about COVID-19 here in our community in Berrien County. We are joined today by Health Officer Nicki Britten of the Berrien County Health Department and Dr. Loren Hamel, President and CEO of Spectrum Health Lakeland. Thank you both for being here with us today. We have a lot to get to. Lots of exciting things have happened over the last week, so we want to make sure we can bring you all of the latest. So Nicki, let's start with you. Can you briefly give us just a contextual update as to what we're seeing right now with our trends? For those who may have been paying close attention, it looks like we've seen a bit of a sustained downward trend. Can you tell us more about that?
Yeah, there has been a bit of a downward trend in the number of confirmed cases over the last couple of weeks. And it really started to go down just after Thanksgiving. And we were initially thinking maybe it was due to just the slowdown in testing around Thanksgiving. However, the trend has sustained for a couple of weeks now. We have seen a decrease in the amount of testing at the same time. So it can be a little bit difficult to tease out, is it less testing? So we're finding less cases. What is that? But as we've been saying all along, the number of confirmed cases, that's not the best or should not be the only indicator of what's going on. It is subject to be influenced as testing strategies change. We know that access to tests, testing supplies, how tests are available continues to shift over time. So right now we're seeing about 100 new cases per day on average, whereas 2 weeks ago we were closer to 150, 140 cases per day with our peak at about 165. So we definitely have been coming down. What is not showing the same downward trend is the hospital census and the number of people who are hospitalized with COVID. And in some ways that is a little bit better. If we're going to look at only one thing to give an indication of what's going on, our hospitalizations is the thing that's least influenced by a testing strategy. If people are ill enough to need hospital level care, they will seek it and they will show up, and we'll see that. And I know Dr. Hamel, you'll speak to this a little bit more, but we haven't really seen the same sort of downward trend. We've seen some leveling off. We haven't seen as much rapid growth. I mean, a few weeks ago, just before Thanksgiving, Loren and I were here talking about some pretty serious concerns about the trajectory we were on. It does seem like we have shifted and adjusted, and we're not on that same trajectory. We are by no means in a really good, comfortable place, though. We still are seeing tenfold higher cases than we were at the beginning of October. And this is not the time to let our guard down, but there may be a little bit of encouragement there.
Well, that does sound encouraging. Dr. Hamel, tell us what's going on at Lakeland. What's the latest at the hospital?
Well, I certainly have been encouraged by the same trends that Nicki just described. And, we had a peak COVID inpatient census of 85. We had a number of days in the mid 70s. We've run a couple of weeks now in the mid to high 60s. And so that has been a leveling off trend. Today we had, for the first time in quite a little while, several weeks, a census in the mid 50s. Now, one day in the mid 50s is not a trend, but it is much better than seeing something in the 80s. The staff are working very hard to take not only care of everybody with COVID, but everybody else who's sick. And our facility has been full. But it is very encouraging to see that stable trend and maybe some really early indication that it's not going to grow and it might even decline a bit. We'll just have to watch that over the next few days.
Well, we know that there has been some very exciting news over at Lakeland within the last 24 hours. This is a momentous occasion. Tell us more about what is going on with COVID-19 vaccination there at Lakeland.
Well, if I was a singer, I might give you a strain of the Hallelujah chorus. We are, in fact, really excited because we have just under 1,000 vaccines allocated to us. Spectrum Health was one of the first 5 health systems in Michigan to get an allocation. Of course, that's spread across the system, but our share here in Berrien County is going to be just under 1,000. And we started vaccinating last night. I was there with a line down the hall waiting to get vaccinated, folks with excitement and a few tears. Our first vaccine went to a pulmonologist who just happened to get there first. and with a smile on her face got that vaccine. You know, we have, it feels to us, we have finally turned the corner from just a defensive strategy around COVID-19 to, in fact, an offensive strategy where we can actually prevent the disease. Now, it may take months to do that. We get that, but it's really nice to get started with vaccination.
It really does feel like hope is on the horizon. Can you tell us more about how Spectrum Health Lakeland plans to vaccinate all of its staff? How are you determining that priority?
Yeah, we have set priorities based on where you work and the exposure risk of where you work. And we also have had to stage, you know, we can't vaccinate everybody on the same day. We have to anticipate not only today's dose, but that dose in 3 weeks. The dose in 3 weeks might be a little more likely to make somebody feel a little achy or a little feverish for a day. And so we're staggering and not immunizing a whole department at once, because we want to make sure everybody's there to care for our friends and neighbors after that second dose in 3 weeks. We anticipate being able to get through most of our highest risk associates within the first several weeks. That's a bit of a lottery. You know, we're picking folks at random within those departments in a certain amount for each immunization cohort.
And Nicki, moving to you, what about the health department? When do you think the Berrien County Health Department can expect to receive its allotment of vaccine?
Yeah, so we have not been allotted any of the Pfizer vaccine. That has gone to very few health departments because health departments generally don't have the freezer capacity for that ultra cold storage. So the way the state has allocated vaccine, it's to prioritize those facilities that have the ultra cold storage to receive the Pfizer vaccine. And part of the comfort, I guess, in doing that is the expectation that the Moderna vaccine, which is the second one, it's actually, there are meetings today about its potential approval for emergency use authorization, really in a parallel process to what we saw last week with the Pfizer vaccine. But we expect that if everything goes according to plan, we expect to potentially receive the Moderna vaccine early next week in those first shipments. We have been told that the allocations to the state of Michigan for the Moderna vaccine in the first week that it is available, which again, we do expect to be next week, that would be double the amount of the Pfizer vaccine that was allocated to the state of Michigan. So the vaccine will be in a little bit more plentiful supply and will need more weeks, as Dr. Hamel said. This is going to take time. The vaccine is being manufactured and rolling out as quickly as possible. But we do expect to receive some of our initial doses next week if everything goes according to plan with the emergency use authorization. We have plans in place for vaccinating the first people that we are really responsible for as well. Definitely working through healthcare providers that are outside of Spectrum Health Lakeland, and there are many of them. Top priorities for the health department is making sure that vaccinators are offered the vaccine, as well as EMS. So we want to make sure that our EMS providers are able to get vaccinated. We have plans in place that we're working with them on to make sure they get vaccinated as soon as possible. And another big area that's in that top priority group is also long-term care facility residents. There are some agreements in place with pharmacies to be doing vaccination in those settings, but we are aware that there are some, I don't want to say gaps, but there are some places that we know the pharmacies will not be covering, and that's something the health department will be doing. So in these first couple of weeks, we're really focusing our priorities, Dr. Hamel's point, those who are at most risk and highest exposure. So we're tackling the EMS and the long-term care facilities, as well as those who will be vaccinating.
And what about the timeline, Nicki? Most people are really wondering, okay, when can I make my appointment? What are we talking about when we're looking at that distribution timeline, and how will people know when the vaccine's ready for them?
Yeah, so I'm going to share my screen here just to be able to walk everybody through what that is. I'm here at the homepage of the health department, which is bchdmi.org. And if you scroll down just a little bit, you see this COVID-19 vaccine information. There's a lot of information here, so I'd encourage you, if you continue to have questions, want to learn more, this is a really great resource to start. We have links to other places if you need even more in-depth information. So up here at the top, we do actually have a newsletter. So you can click here to sign this, enter your information, your email address, and we will keep you posted as on information we are putting out about the vaccine and how it's progressing through the priority groups. But there is also a pretty detailed list, which you can find this other places as well, but we do have on our website with what the different priority groups are. Many of you, I'm sure, have heard us referring to priority groups 1A, and that's the first, that's the healthcare providers and the long-term care facilities. There are stratifications within that group because even long-term care facilities, healthcare providers, that's thousands of people. So you have to know where to start. So there's some priority groups in there that align with what Spectrum Health Lakeland is doing. Once we get to this phase 1B, that is going to open things up quite a bit for essential and critical industries, and there's some more definition around that. This is when a lot of other people, based on their profession, will be included in that. Timing wise, it's going to take a while for vaccine levels to build up and to work through this priority 1A. But when we get to priority 1B, that could be potentially late February, it could be March. It's possible it could be sooner, just depending on how quickly we're able to get vaccine into our communities. There will also be some movement to make sure that the state is moving through these priority groups at about the same time. Because if you have one community that is really sailing ahead and going faster, people from all over will go to that one community to get the vaccine. So having this kind of phased approach where across the state we're working through these in relatively similar timelines. But so the group 1B is essential workers it includes educators and childcare providers. It includes 16 sectors of critical infrastructure. A lot of these are the people that continue to work during the stay-at-home order. But then we also have some other congregate living and high-risk situations. And there may be some other things in there, but that gives you a general sense of who will be that next wave after the healthcare workers, the long-term care facilities. And then after those workers, we'll be getting into people who are at highest risk of severe illness due to underlying medical conditions or age. And this will really open things up. It will likely be April, May, by the time we get to these. However, as the risk groups continue to open up and be more available to the general population, it will become easier and easier to get a vaccine. It will be available in more settings. It won't be just the health department you need to get it from. Primary care providers will begin having the vaccine. Maybe not all of them, but it will become more abundantly available and it will be easier. So if you really want to track this, make sure you know when you're ready. We encourage you to sign up for this newsletter. Again, there's a lot of hope. We are super just excited and encouraged by the fact that we do have a vaccine, hopefully soon to have 2 different vaccines, and there are others that are in clinical trials, but it will take time to distribute and administer the millions of doses it will take in this country to get us to those high levels of coverage.
Wow, there's a lot of planning that's going behind the scenes and making sure that this can roll out. Dr. Hamel, can you tell us more about the different vaccines, how they work, maybe what the side effects are, and if the 2 vaccines on the market or soon to be on the market right now are comparable?
Yeah, for sure. This is a really exciting development. Not only did we develop vaccines in record time, it really is it's a kind of a new way to manufacture a vaccine. The Pfizer vaccine has a tiny snippet of RNA, that's genetic material that replicates part of the RNA in the virus. It's not a live virus, it's not an attenuated virus, it's just a little tiny copy. And when your immune system sees that, it says that doesn't belong, let's make an antibody. That antibody, of course, is what protects you if you get the real virus exposure. I mean, it's an elegant way to stimulate your own immune response in a natural way to get ready for that infection, that virus, should it be transmitted to you. It's just a tiny snippet of genetic material wrapped in a tiny bit of lipid and then frozen and ready for injection. There's no mercury, there's no aluminum, there's no microbots, nothing else in there except just a little genetic fragment to get your immune system a head start. It really is an elegant way to make a vaccine. It's been studied. 40,000 people have had the dose in clinical trials. It seems incredibly effective and very, very safe. You know, we don't expect serious long-term side effects from this. It's not an infection. It's not an attenuated germ in some way. So we just don't expect those long-term complications, and hopefully that will bear out. I'm sure going to take one when it's my turn. I'm not first. I hope you take one when it's your turn. The way to get over this together is to make sure that we all have immunity. So please do that. I would just make one more comment about immunizations here, and that is, don't call your doctor's office today and say, I want to do a cruise in January, can you immunize me? It's just not available. You know, it's going to be available for everybody in time. There's no question about that. But we just don't have doses on shelves that we can say, here you go. Now, that may occur down the road, but just be patient and watch these updates. And as you know, as your group gets ready, as your cohort, you know, depending on your job and where you work, is ready for the vaccine, we'll let folks know and how to get immunized.
Yeah,
Certainly.
and I mean, if I may add, to that point, it's going to take time, months, till we get the vaccine available to the broader general public. And so in that, we do need to continue our diligence and our preventive measures and avoiding large gatherings, minimizing the amount of close contact you have with other individuals, wearing your mask, having that social distance, washing your hands, all of those things, staying home when you're sick. All of those things continue to be incredibly important, as it will take time. The presence of the vaccine is incredibly hopeful, and we're on that path towards getting people at those levels of immunity really up high to slow transmission in our community. But we're going to need to be vaccinating people as well as being really diligent in those protective measures for the coming months. So don't throw your masks out just yet. You're going to need them.
Mm-hmm.
Okay, so no big parties come January, no throwing away our masks just yet. We've got to stick with all of those things for the meantime. Nicki, one other question that we've heard frequently from folks is wondering about the cost of the vaccine. What is it going to cost people?
Yeah, that's a great question and really, really important. So cost will not be a barrier for anybody, and nobody is allowed to be charged or billed for the vaccine itself. That is something that is being provided to the American public. It's kind of been paid for with federal dollars and all of that anyways. There are likely to be instances where providers may charge an administration fee for the vaccine that would be billed to insurance. Providers and insurance companies are not allowed to back bill patients for that administration fee. So you may be asked for insurance information. If you do have insurance, it's a good idea to bring a card with you when it's your turn to be vaccinated. If you don't have insurance, you don't have your insurance card, that's okay. You can still get a vaccine, but you may be asked for that information so that your insurance company can be billed for an administration fee.
Wow, this has been a really informative session. Thank you both for this information. We know that there's still more coming out. Things are changing by the day with vaccines. So we know the health department has a newsletter that you can sign up for, updates that will be sent straight to your inbox, ways that you can get more information provided straight to you. We are going to be taking a little break from our Facebook Lives next week for the holidays. Is there one piece of information that you'd like to give, one last parting word, Dr. Hamel, before we take a short reprieve before coming back to our Facebook Lives?
I sure would. I just want to say thanks so much for your efforts. We can see that in those declining trends of new confirmed COVID cases. We could not do that without you. Thank you so much for that. Please have a very safe, a very blessed, and a COVID-free holiday season. Be careful for several more weeks. That's going to be maybe a few more months. It's going to be very, very important, but we are going to get through this together. And I just like to thank you for what you've done to help make this more bearable for our community.
And Nicki, any closing thoughts from you?
I mean, ditto. And I mean, I hope that we continue to just see how collectively we're moving through this together. Our actions are protective of others. And when we are diligent in wearing our mask and our social distancing and making sure we're getting vaccinations, we are all taking these actions to get us through this pandemic out onto the other side, which I know is something that we all are hopeful for in 2021.
Certainly. Well, thank you both again. We will be sharing more information as it becomes available. As always, resources are out on our website, Berrien County Health Department at bchdmi.org, Spectrum Health Lakeland, as well as a new resource that is part of a collaborative of counties throughout West Michigan that can be found at vaccinatewestmi.com, and we'll provide these links in the comments below. Thank you all again for joining us. We wish you a blessed holiday season, and we will be bringing more information as it is available. Thank you.
Thank you.